Here, what we're going to be doing is called an ankle brachial index. We use this for patients that present with cardiac issues, strokes, or leg issues to check the blood circulation to make sure they don't have any clots. This is where we basically are going to take a blood pressure cuff and we're going to place it on your arms and your ankles. And I will inflate it. On deflation, I will be listening for the first sound, which is the systolic sound. I will be using a Doppler to listen for the pulses. I will palpate and listen to the brachial pulse on the arms and the dorsal pedal pulse on the feet. After I get all my readings, I will then calculate them. Now we're going to do the right arm. Found it. Alright. Here we go. Did it come on? Okay. $132. Right leg. All right. Here we go. You know, video this. Left leg down the dorsal pedal. All right. Calculate my readings that I got from the ankle brachial index test. To do this, we're going to take the highest number of between the two arms, which is 134. We're going to divide it into the numbers we got at both ankles. So how we do that is we're going to do right ankle over right arm, left ankle over left arm. Left arm. So right ankle was 136. Then you're going to do over 134. Left ankle was 144 over the same 134. And the numbers we get for those are 1.01, 1.07. Our patient would be classified as normal. I have the norms over here. And normal is considered greater than 0.96. As you can see, my patient is greater than 1. Here, I'm going to be listening for heart sounds, the lub-dub of the heart. First, I'm going to ask my patient if he is comfortable with taking off his shirt so I can put the stethoscope on his chest. First, I'm going to clean the stethoscope. So the lub part that I'm going to be listening for is the S1, which is the closing of the tricuspid and mitral valves. The dub part is the S2, which is the closing of the aortic and pulmonic valve. The S1 is the start of systole, and the S2 is the end of systole. So the aortic valve is located where you see it at now, which is the second intercostal space directly to the right of the sternum. The pulmonic valve is located in the second intercostal space directly to the left of the sternum, as you see now. The tricuspid valve is in the fifth intercostal space directly to the left of the sternum. And then the mitral valve is located at the apex of the heart, which is also in the fifth intercostal space at the midclavicular line, which is roughly at the nipple. Here, I will be listening to normal or abnormal sounds of the lung. I will place my stethoscope in 7 different places on the front of the chest and 10 places on the back of the scapula, going from the superior angle down the medial side of the scapula to the inferior angle on each side. I will move the stethoscope from left to right in sequence to compare each side. I'm specifically checking for crackling or wheezing sounds. Those would be considered abnormal sounds. Cracklings would sound like fluid moving in the lungs, and wheezing would sound as if you're struggling to breathe because your airways in your lungs are narrowing. Deep breath. The patient will take deep breaths each time so I can hear the sounds. Okay, you can relax. I'm going to be a student physical therapist today. Alright, so we're going to start off by, what is your name and date of birth?
My name's Eli Matthews. My birthday is 08/31/1996.
Okay, great. So Eli, what brings you in today?
I've been having some low back pain.
Okay. And where exactly is that pain?
It's kind of like, it kind of hurts all over the place, but it's like right in the middle of my back. Like it would be the middle or maybe a little bit to the right.
Okay. All right. And what would you rate that pain on a scale of 0 to 10, 0 being the least pain, 10 being the most pain, like excruciating?
Okay.
Right now.
So right now, I'm probably about like a 4.
Okay. I'm just gonna write, just, document. And what would you say the worst pain is?
I would say probably it gets up to around a 7 or 8.
Okay.
So I would say like an 8.
An 8. And at its best, what would it be?
At its best, I would say maybe like a 3. Yeah, so I'm feeling pretty good right now.
There you are. Okay. And how long have you had this pain?
It's been going on, I'll tell you what. So recently I've been doing a lot of working out, I just got back in, I had a break from school, so I started working out a lot, and I was trying to do, the big deadlift, and I think I hurt my back a little bit doing that, trying to pull. It was it was when I was pulling it off the floor, it kind of hurt.
Okay, and that's where you just pull up?
I was pulling from the straight bar on the floor, and I went to pull up. It wasn't that much weight. I just thought, I was like, oh, I can do it, and it kind of hurt. I didn't feel any crack or anything, but it was later that day, it was ooh, my back kind of starts to hurt, and it's like I said, that middle to right side.
Okay.
And that was probably about 2 weeks ago.
Okay. And have you had this pain though before that, or is this something new?
Yeah, so I do have. When I was 15, I got an MRI and I had herniated discs.
Okay.
So I've had herniated discs. I'm pretty sure they said it was L3, 4, and 5 were herniated. And so, I went to therapy, and it was I did therapy for I think maybe a month and a half, 2 months, and I walked out completely healed, fine. I was in no pain, and so that's why I came back so soon, because I knew that maybe something like that's happening again, and so I thought I'd come back and see you guys.
All right. Yes. I'm glad you came back. So what does anything make it worse?
Does anything make it worse? No, it's all right. It's all right. Does anything make it worse? Yeah. So bending over makes it worse.
Okay.
And then if I try to pick anything up off the ground, so like I said, now I'm back in school, so sitting kind of hurts a little bit. But anything where, say I have my textbooks on the ground and I have to pick them up off the ground, that hurts. So pretty much anything bending over and picking it up.
Okay. All right. And so what do you do whenever it starts hurting? What do you do to make it feel better?
What do I do to make it feel better? So what makes it feel the best is when I lay on my ground, lay on my back on the floor. So I lay on my back on the floor and prop my legs up on something. It keeps my legs nice and flat, or my back nice and flat, so that my back's not arched, And that makes it feel the best. And then obviously if it really, really gets bad, I'll put some ice on it.
And how long does it take for that to get better?
Probably 10 minutes. It's not a long time.
And do you think it's getting worse, or is it staying the same?
At first, I would say it was that day when it really started to feel it hurt. It got progressively worse, but since then it's been getting better.
So the pain, would you say it's constant? Is it a constant pain, or does it come and go just whenever you do that?
Yeah,
exercise?
it's not a constant pain. It's whenever I bend down is when I get that sharp pain.
Okay.
But when I'm kind of standing up straight, it's not really hurting. It's kind of a dull, it's there. I can tell it's there, but it's not a sharp pain. But as soon as I go to bend over and pick something up, is when it gives me that sharp pain.
Have you been to the physician about it yet?
I have not.
Okay. Are you taking any medicine?
No, I don't like to take medication.
So you go to grab a needle with a tight grip.
Does the pain keep you up at night? Does it wake you up?
I would say maybe once. Yeah, I'm kind of a light sleeper, so it maybe does wake me up. I can't really tell. But what I would say is if I do wake up, I kind of wake up on my side-ish stomach, which doesn't feel that good. So then I roll back onto my back and then I fall right back to sleep. So.
Well, that's great. I think I have all the information I need, and we can
whole thing is
Any questions for me?
I do not.
Hi.
It was very nice meeting you.
You too.
My name is Elijah Matthews, and I approve this message.